Hi, we are now live on Facebook with Dr. Heather Johnson. I want to apologize that we're a little bit behind. We had some technical difficulties, but we made it. We are here on this wonderful Wednesday. The sun is shining. And it's a beautiful day. How are you, Dr. Johnson?
I'm doing just fine.
Great.
Enjoying
Today,
the sunshine.
that's awesome. Today we are going to be talking about birthing in the time of COVID-19, as we have been dealing with this virus for a whole year now. Can you believe it is almost a whole year next month? And so I wanted to just introduce myself. I am Jacquelin Knighton. I am co-owner of Doulas of Capitol Hill. We are a full-service maternity agency. We have in the DMV, we serve the whole DMV area. We have an amazing team of 26 doulas. So that means you get to a wide range of doulas to choose from to help you and be on your birth team. We have doulas, lactation consultants, and other professionals in the birth world, like photographers as well, and car seat techs and massage therapists. We are your one-stop shop. We provide non-judgmental support to all families through pregnancy, birth, and throughout your first year of postpartum. That's a little bit about me and about Doulas of Capitol Hill. Dr. Johnson is an OBGYN and senior partner at Ryder Hill and Johnson and Avantia practice and an author. Do you have your book with you?
I do. I will hold it up here.
Yes. And this is What They Don't Tell You About Having a Baby. And this is available right now, right, Dr. Johnson?
It is, yes.
Okay. And people can purchase it where?
On Amazon, Barnes & Noble, Nook, a few other places, but yeah.
Awesome. Great. Dr. Johnson is actively practicing gynecologist and recently retired obstetrician after 40 years in the game, a long, long time. So get the book because she knows what she's talking about. The practice that she's at, Ryder Hill and Johnson, is in DC, Chevy Chase, and in Falls Church, Virginia. She has been in private practice since 1987. She received her MD at Yale University School of Medicine and completed her residency in OBGYN at Walter Reed Army Medical Center, and then relocated to Washington, D.C. And she served in the Army for 8 years prior to going into the private practice, and has 2 kids of her own and 2 grandkids. With us as well is Emily. I know you guys can probably see her face. She is quiet in the background, here to help us with our technical difficulties. But we also have our social media manager at DCH, Doulas of Capitol Hill, Ashley Woodsley. She is in the chat, so she will be able to answer any of your questions as we do this live. So if you have any questions about what we're talking about, or any questions that you want to ask Dr. Johnson while we are live, go ahead and type them in the chat and Ashley will read them off and get them answered for you. All right, so I guess we can start. We're talking about COVID. So my first question, of course, is the whole new thing of the vaccines that are happening for COVID-19. It's on everybody's mind and everyone wants to know, especially those that are pregnant or breastfeeding or planning to get pregnant. Is the COVID vaccine safe for pregnant women or breastfeeding women right now? Do we know anything about that?
The answer is almost 100% yes. And I say almost because it hasn't been tested on pregnant women. So, I mean, you don't test new things on pregnant women, but thousands of women have gotten the vaccine pregnant without a problem. There are other vaccines that are perfectly safe during pregnancy, as long as it's not a live virus. The flu shot that we ask pregnant women to get every year, we can safely give even in the first trimester because it's not a live virus. And the same with the COVID-19 vaccine. It's a protein that cannot replicate inside of you. So it should be safe, but we can't officially say that until the tests have been finished. They're already started. The World Health Organization and the American College of Obstetricians and Gynecologists are updating their recommendations. Initially, they said, we don't know anything. And then they said, well, it's probably safe, but we can't promise you. And now they have announced that you should not withhold the vaccine from pregnant women because they are pregnant. Workplaces and other things should not refuse to give it to them because they're pregnant. So that's all but saying, please go out and get it.
Right. And this is in all trimesters of being pregnant from very beginning to the very end. And is there any difference between the Pfizer or the Moderna? Do they recommend either one, or you can take whatever one's available to you?
So at this point, it's whatever one you can get. They are using the same protein, and they're all, none of them are live vaccines. So usually, unless you're a healthcare worker at a hospital, that's where you're going to get the Pfizer, because it requires refrigeration that most other places don't have. And then the Moderna is the ones that you're getting at Safeway and Giant and other places. And it sounds like the Johnson & Johnson one may well be approved within the next week.
Awesome. Awesome. So it's safe for pregnant women and breastfeeding women to get the vaccine. So it's highly recommended that they do to protect themselves. Once they get the vaccine, do they need to continue to get tested regularly if they've come into contact with someone with COVID or traveled or anything like that?
So we don't have data yet for that. We're going to go by common sense things until we actually have the data. You have to remember that you need to wait 2 weeks after your second dose before you can consider yourself protected. And that means that even if you did get COVID-19, you would likely not be, you very likely will not die, and you very likely will not end up in the hospital, but you might have a minor illness. So we don't know yet whether you would be contagious. And so the reasons for testing should probably remain the same until further studies are done.
Awesome. So if you've been around someone or you suspect that you have come in contact, probably still go get tested.
Yeah. Mm-hmm.
Awesome. And then switching gears a little bit, it is Black History Month. And so we are celebrating all things Black and Black birthing. And so with that, there are some health disparities that Black women experience when they're having a baby, but not all Black birth experiences are horrible. They are very positive and have very healthy outcomes as well. So we want to celebrate that too. But one of the questions I want to ask is, what are the most important factors to take into consideration when you become pregnant? As far as genetic testing, gestational diabetes, weight gain, preeclampsia, some of the things that can come up when you are, become pregnant or thinking about becoming pregnant.
Well, thinking about becoming pregnant is probably the best time to address the genetic issues. It's recommended by, and I'm just going to say ACOG for the American College of Obstetricians and Gynecologists because it's a mouthful, recommends that the woman get tested, in her preconception counseling or planning session. If she carries a recessive genetic disorder, then her partner needs to be tested. And if they both carry the same one, there's a 25% chance that your child will have the actual frank for real disease like cystic fibrosis or sickle cell anemia. And that's something that shouldn't wait until you've gotten your positive pregnancy test at 6 to 8 weeks, because there's a very short window of time for doing studies after that. Before pregnant also, you should be starting your multivitamins that contain folic acid to decrease the risk for neural tube defects, spina bifida, meningomyelocele, anencephaly, all these fun things. If you have diabetes or you had diabetes with your previous pregnancy, you really want to get a health profile and check your hemoglobin A1C, which measures what your blood sugars have been like over the last 3 months. So you can't cheat and fast that day and have a good answer because it tells what you did before. Because especially with real diabetes, there are risks for malformations, miscarriage, and that sort of thing. So get yourself into good physical and chemical shape ahead of time. Same with your blood pressure. There are blood pressure medications that are safer and preferred in pregnancy than others. And the time to make that switch should be before you get pregnant, so that you have time to follow up with your primary care and make sure you're stable, not having side effects or reactions.
Absolutely. And as a mom of two, and doula, if you have any questions when you become pregnant or any of these health concerns come up, I definitely encourage you to ask your healthcare provider all of the questions. Make sure that you're thoroughly understanding what is happening, what are your options, so that you can manage this care effectively. Next, what are 2 to 3 most frequent questions that you receive in pregnancy? I know you've seen a lot of patients, and continue to see a lot of patients, but when you were delivering babies all the time, what were 2 of the most frequent questions that you got?
Um, that's difficult. Some of the, the initial ones and the things you're most worried about are, what things can I eat and what things in my everyday life are dangerous. Is it okay to take this vitamin? Is this product that I put on my face going to be harmful? Can I eat sushi? And yes, you can. You can now eat sushi as long as it's fresh, is the official recommendation, though I don't know who that likes sushi wouldn't eat fresh sushi, but that's neither here nor there. And weight gain, it sounds like a really difficult thing to do, to gain 25 to 35 pounds, which is the recommended. It's frighteningly easy to do that. Anyone who's had a baby is going to know that if the extra protein that you get in your body, the extra iron and things are going to add up very quickly to that.
Awesome. What are your thoughts, if you have any, on breastfeeding and pumping versus formula, or do you recommend a combination of both? What are your thoughts on that?
So really the phrase breast is best is breast is best, all other things being equal. And that's the important thing. All other things being equal, your baby does better, you do better if you're breastfeeding. There are women who can't make enough milk. We have an older population in my practice, and just people in their 40s tend to have a little bit more difficulty doing that. So you may have to do a combination of breast milk and bottle milk. Fortunately, there are a lot of good and healthy ones to use. And it shouldn't be considered a crime or a failure if you can't. I mean, you just do what you can. I think everyone should try, if they can, just to pass the antibodies on safely in the first few weeks. And then if it doesn't work out for you, then it doesn't work out for you. Pumping is, it's actually better. That's one of the few things that are better during COVID, because you don't leave home. So you can feed your baby or pump a little bit, but you don't have to go to work with, pumps and kitchen bags and all kinds of things, freezing the milk in order to bring it home. And there are kinds that you can use when you're driving the car. There are hands-free. There are all sorts of things. And formula, if you need to, it works. You'll get very healthy babies. It's not on the entrance exam to Harvard, whether you were breastfed or not. I've seen too many people pumping, and not getting any sleep ever, because they're absolutely focused on only breast milk. But it is best if you can do it.
Absolutely. At Doulas of Capitol Hill, we have lactation consultants, and our lactation consultants are doing visits right now. So they are able to come into the home. They are wearing all their PPE. We are requiring everyone on our team to get tested once a month. So they are testing regularly, and those that are eligible for the vaccine are choosing to get it. So we are playing it really safe over there. But one of the things about seeing a lactation consultant is that they can help with any feeding issues that you're having. And so they can help with those latch issues when you get home, because it's really easier to breastfeed in the hospital when you always have a nurse or lactation consultant helping you latch that baby on. It seems like a cinch. And then when you get home, you're like, wait a minute, why does this hurt now? And so having a lactation consultant that can come to your house and help you latch or do a weighted feed to make sure that baby's getting everything they need and then also helping you understand your other options, whether you want to formula feed. It's not as simple as always, just going to the store and picking up the latest Similac, right? Your baby may have some intolerances that you might need to have another one. And so they can help with that. And they can also help you understand your options as far as donor milk as well. So I know that I've donated breast milk a ton of times with my previous two children. So those are so many options. And so I just definitely think that you should see a lactation consultant to discuss all of your feeding options. So that's really good. Like, I love that you said that it's not on the entrance exam to Harvard. So if you need to breastfeed or formula feed, there is support for you. But hopefully, like you said, breast is best. So if you need help making that be successful, definitely see a lactation consultant.
Yeah, I really want to echo that. I mean, lactation consultants are fabulous, even if it has to be done by telemedicine. I mean, they can kind of watch you, but just the reassurance that you're not the first person in the universe that this has happened to, and that you don't need to recreate the wheel. There are people out there with the knowledge and the skills to be able to help you through it.
Absolutely. Absolutely. Within the first 6 weeks after giving birth, what can a new mom do to feel physically better? If any exercises are okay, are they okay to go ahead and start exercising immediately as soon as they're feeling better? Should they wait till their 6 week checkup? And what are the top 2 to 3 do's or don'ts of it?
Yeah, so some of
Matter
the
with delivery, if it's a C-section or vaginal delivery, taking all of those things into account.
Right. That was what I was going to say. The first thing is, what kind of delivery did you have? And what kind of labor did you have? I mean, were you in labor for 3 days, or did you just walk in after 4 hours of labor, squat in the corner and have a baby? It makes a big difference. And what support you also have at home. The first 6 weeks is not a time to get in shape. You just need to move those muscles around and feel better. Give yourself a week or so, if you've had a C-section, a couple of weeks, to then get outside every day if you can, even if it's for 15 or 20 minutes, to not smell like milk, and to go for a walk, see trees and leaves and children and that kind of thing. You can do minor exercising like walking. I wouldn't, maybe some hand weights or something, but things basically to make you feel better rather than to get you into shape. And you wait for the 6 weeks postpartum for that. Remember, especially if you're breastfeeding, though, to thoroughly hydrate yourself whenever you do these exercises, because you already need tons and tons of water for your breast milk.
Absolutely. I know that I always encourage my clients to, especially now that we're heading into the spring, in the summertime, we're kind of limited on where we can go because there's still a pandemic happening, even though we've been in it for a year and it seems like it's never ending, or maybe things seem safe, it is still happening. But because it's getting so, heading into that spring and that summertime, it's always great they always say, when can I take my baby out? And I'm like, you can go out now. You cover up your baby in your stroller and you walk up and down your street, get fresh air. It's healthy for everyone. I'm not telling you to go to your farmer's market and go shopping with this brand new baby, or go, to the mall or anything. But definitely, I agree. Getting outside, getting fresh air, walking up and down the street can be helpful for physical health and mental health, really getting out the house.
I remember once working with a woman. She'd had a very long pregnancy, and I'd known her for a while before. And she came to her postpartum visit without her baby. And this was before COVID. And I was very upset. I wanted to see that baby. And she said it was cold. I think it was maybe 32 degrees or something. And I said, aren't you from Russia? It's just, the babies are fine. You just need to wrap them appropriately and, cover them and let them get the fresh air. They sleep better for sure after being outside.
Absolutely. I know that my kids are 5 and 7, and they do better being outside than they do in the house. And it's been so difficult during a pandemic and during COVID to be able to get out, and they're not going to school. So any chance that we get when the weather is halfway decent, we go outside. And I always say, kids do not get cold at all. They can be out there in the snow and it's sleeting and everything, and they're just like having fun and playing. And so definitely being able to get out and get some fresh air, which leads me to my other question, is COVID-19 and isolation, postpartum isolation. what are some tips and advice you have for new parents to support, to get and receive support during the pandemic?
Yeah. Fortunately, that's getting a little better. A lot of grandparents now have gotten the vaccine because they're over 65, many of them. And so you can start importing them from other places. Before, it was a whole come to the area, isolate for 2 weeks and do those things. You do still have to be very, very careful. You were saying about your lactation consultants, and I'm sure postpartum doulas are the same, are tested and, follow the rules. And so that's important. You do need, it's hard enough for all of us, as we found, to be locked into our homes. But to be locked into your home with a baby, especially if it's your first one and you have no idea what you're doing, with just you and your husband, if you can get another human being in there that's safe, you want to do that.
Absolutely. We definitely, you mentioned our postpartum doulas, and they are still going out to homes and providing help. And that's daytime shifts or overnight shifts to new parents. And they're getting tested regularly. And like I said, some of them are already getting vaccinated that they can. We also have tons of resources to be able to give to new parents. So if you need to see a therapist, and I know that therapy even kind of looks a little different nowadays because telemedicine is taking over the world with the pandemic. So, but you can still see a therapist, and you can also see there are specific therapists that help in perinatal mood disorders, or are specializing with pregnant women, or women that have had babies. And so, if you need those supports and resources, I definitely encourage you to reach out to Doulas of Capitol Hill or Doulas of PG County, or even your provider, your OB. To get those resources to be able to help you cope. A lot of times, I know I get a lot of clients who have anxiety or depression that have been, present in their lives before, and so that could just manifest even more in pregnancy. So those types of helps can be there, and definitely relying on your friends and family around you, or your bubble. A lot of people have these COVID bubbles where they've been isolating, and just have those people that they're around to keep them, everyone safe. So definitely rely on those people.
And those people can still do important things like dropping off food, or going grocery shopping for you and dropping it off. One of the things that I noticed the most when my daughter had her first baby, were her friends who just dropped by, spoke very briefly, oohed and awed at the baby, and then just dropped off food. And now you can literally just drop off food and are appreciated for it. When you talk about the depression and anxiety, it's really important, like you said, to have therapists, which are hard to come by right now because they're really overworked themselves. And talk therapy is fantastic, but there are going to be times when medication is recommended. And breastfeeding should not be an obstacle to that. This is not something you should tough through to the bitter end. If you need medication, it is better for you and your baby and your entire family, really, if you get the care that you need so that you can care for them.
Absolutely. One of the things that I wanted to share is that currently I am 32 weeks pregnant. I'm pretty sure you can see it all in my face of being so swollen. But it is a surrogate pregnancy. So this is not my own child. I am carrying it for someone. And anyone who is interested about surrogacy, what it entails, what it looks like, they can definitely follow along on our sister company, Doulas of PG County. I have a blog there that I've been writing about to help other women understand, because even if you don't want to be a surrogate and carry for someone else, the IVF process and the infertility, the process of trying to get pregnant and what that looks like, I just wanted to give an inside view of that to other women. So, because sometimes it can seem a little taboo to talk about. And so I wanted to be able to blog about it and just give my a firsthand account of it. With my first two children, I was completely healthy with both of them. And then after doing the IVF, where we created this embryo, which was then implanted inside of me. So this baby is not genetically related to me at all. But after we've done the transfer with the embryo and I became pregnant, I started to experience hypertension. And so while I haven't been completely diagnosed with preeclampsia yet, I think my OB is being very generous with me. I'm with the MFMs, the maternal fetal medicine doctors at GW. It's still alarming because I've never had to deal with this. I have to take my blood pressure often, and though they haven't put me on any medication because we are monitoring, which I definitely prefer monitoring over medication if possible. It's a new thing. But what is not new is specifically we know that Black women have higher rates of preeclampsia and hypertension when delivering, and which can be serious and sometimes fatal during pregnancy or during delivery, especially with low birth weight babies or delivering earlier. So I wanted to ask you, as far as fertility and preconception, what are your 2 to 3 frequent questions you receive for people who are trying to conceive?
Okay. I'm going to back that up a little bit and make a couple of comments. First of all, I think giving blood is a nice thing. Giving a kidney is a great thing. Giving your body for 9 months is absolutely amazing, and I applaud you for that. And you knew better because you'd already done it twice. So it is the most wonderful gift you could give someone. I admire that. I do.
Thank you.
And your comments about the IVF, I think most people don't understand how involved that is. How much time it takes, how many shots you have to have, how crazy they make you with these levels of hormones and things. And you already feel like perhaps you've been pregnant for 7 months before you get the 6-week thing. You're already tired from the race, and now you have to start the pregnancy. So, and you knew it would work because you'd had babies before. It's a little more difficult for people going around that the first time. You also didn't have to pay for it, I'm assuming. So, which is a big thing for people. Yeah. As far as the hypertension goes, yes, there's genetic predisposition, and there are also ethnic predispositions. Age does play a role in that, so that 20-year-olds usually don't have hypertension in pregnancy, 30-year-olds maybe more, 40, the older you get, the higher is that risk. And pre-existing hypertension, and then pregnancy-associated hypertension, and then preeclampsia. It's like a long road that you can go down. And it's a race to get to the finish. And hopefully your baby delivers spontaneously before you ever get sick enough that other decisions have to be made. And that's why it's important to follow regularly with the MFM, checking your blood pressures at home, monitoring your diet and weight gain, and all of those things. But it does happen at times that the environment that your baby is in becomes less conducive to growth and health, and a decision would have to be made to deliver earlier, which requires intervention. And again, prefer to avoid that if at all possible. But at the end of the day, you want you and the baby to be safe, and you should be it sounds like you're part of this team, and they're talking to you about their goals, what they're looking for with the non-stress tests and the biophysical profiles and the urine tests and everything. So insist on being a part of it, and work as a team, which I think, most physicians nowadays are willing to do.
Absolutely. One of the things you mentioned was, especially doing IVF, or whether you're doing IUI or timed intercourse, anytime you're working with the RE, the reproductive endocrinologist.
Yeah, reproductive endocrinologist, REI, reproductive endocrine and infertility.
Yes.
Yeah.
And you're working with them, whether you're, at your fertility clinic. One of the things that you mentioned is that there's so much that you're doing before you're actually pregnant. You have to go through the medical screenings. You have so many painful shots that you have to go through, and medications and pills and vaginal inserts and all of the things that are just unknown. And me being a doula, and like you said, being a part of my team, I was already equipped to, once we got pregnant, and I got to my team, and working with the MFMs and being able to advocate for myself, that came really easy for me because it's what I do every day, but it's not what everybody else does every day. And so Emily and I, who is my co-owner of both DCH and DPG, realized the importance of help during preconception and all of the women who may be going through infertility issues or trying to conceive, and how helpful it could be if they had a doula to help them walk through these steps. You don't only just need a doula once you actually have the baby. Some people get pregnant and they have the baby, and get pregnant and they're ready and looking for their doula. But those people, before they actually get pregnant, can use some support as well. And so we started a fertility concierge service at both agencies, so that you're able to hire a concierge doula with fertility services to help you kind of hold your hand through the process, give you tips and tricks. And we have a couple of fertility doulas that are able to do that, that are on our team, that can work with you. So if you are experiencing that, if that sounds like something that could be helpful to you, if you have questions, if you're thinking about trying to conceive, we are there to help you with that as well. So
let me just tell you, that question came up from one of our patients the other day. I didn't know this, but I am going to get that information directly to her. That's great information. Thank you.
Absolutely. It has been, especially for me personally, going through the process and seeing it, firsthand. It definitely has helped me to see how tough and mentally draining it can be. Of course, physically draining. We know that with women who are trying to conceive, and I wasn't any different from that. This wasn't anything like my own pregnancies, right? This was medically induced. So it was a lot of information, and just a lot. So we are so happy to be able to provide that. So definitely let your patients know. And if you know anyone who is trying to conceive and could use some help and some hand holding and some support, we are definitely there for them. And so I just want to thank you for having this live with us and staying in there with me during these technical difficulties we had, but we figured it out and we were able to get it done. And so I just want to thank you again. I want to remind everyone that Dr. Johnson is an active practicing gynecologist with Ryder Hill and Johnson, and she is a author. Can you show your book again so that everybody who is watching can go get your book? Available on Amazon, Barnes and Noble.
Actually, there's two books.
Two books.
The baby, whoops, wait a minute. There's the baby one. But for a little bit after that, how am I doing this with my camera? That's the baby, what they don't tell you about having a baby. And this is what they don't tell you about menopause.
Right. So the whole, awesome.
Right. That starts in your 40s, the pre-pre, 40s, 50s, and 60s. So we've got things covered from about 18 to 58 in those two books.
Absolutely. So definitely go out and pick up those books. And if you want to connect with Dr. Johnson at all, you can follow her on Facebook at Ask Dr. Johnson. Follow you at AskDrJohnson.com. And then you're also on Facebook under the same name?
Yes.
Awesome. Great. And then I am Jacquelin Knighton, co-owner of Doulas of PG County and Doulas of Capitol Hill. We serve the whole DMV area with all services, and we would love to hear from you. If you have any questions or concerns, you can reach us at on Facebook, Instagram, or on our websites at the names. And Ashley will put all of that information in the chat box so that you can see how to reach us if you desire to work with us. So thank you, Dr. Johnson, for this. We really appreciate it. Enjoy the rest of your week.
You too. And enjoy the pregnancy.
Thank you. Thank you.